or whatever. Hi, everybody. Thanks for joining us. Good to be here again. I was just saying to my guest, Brenda, how energizing these live talks are for me. I work for myself. I'm often alone. And when I do visit my clients, I'm kind of in and out of residences. So I don't really get to establish those long term relationships. So it's always really nice for me to have these conversations with colleagues. This topic, although I don't have a child with special needs, I have to say that I'm a worrier, which I talk about pretty much every episode because I worry about everything. I do worry about my kids and they don't have special needs. And I think, geez, what would happen if I were sick? What would happen if I die? You know, I'm married. My husband is quite capable. My kids would not be left alone. Our guest, she is a single parent, so that she doesn't even have that, I guess, I don't know what the word is. I'm losing my words.
Fallback.
A fallback plan, or at least the security that there's another parent. But for me, I do think about that. You know, what would happen if something were to happen to me? Who would take care of my kids? And when you have a kid with special needs, it's not the same as I think about my kids. Like my kids are 16 and 13, and obviously they still need an adult and they will for a while, but they're not that far away from being able to get a job and earn income and take care of themselves. But for a kid with special needs, that's not the case. They need care and support for an extended period of time and likely their whole lives. So the thought process of, okay, who's going to care for them when I'm not here or if something happens to me is very real and I'm sure quite scary. And we're going to talk about that today. And in that same area, we're going to talk about the financial costs of caring for someone long-term like this as well. In the world of aging, you know, we might have to help our parents out, but it's typically for a limited amount of time. But again, kid with special needs, lots of money is going out the door and for good reason, of course, but throughout the child's lifespan. So lots of things to think about. So I'm so happy to have Brenda here with us today. Hi, Brenda.
Hi, Stephanie. Thank you for having me.
It's my pleasure. And by the way, James Smith said Brenda is awesome, a total rock star.
Thank you, James.
So let me tell you a bit about Brenda. She's she's a master in advocating and navigating the confusing world of disability. Her personal experience has enhanced her ability to help others navigate the complexities of the healthcare system. And beyond the lessons that motherhood and caregiving have brought into her life, she's also a board-certified patient advocate, a peer health navigator, certified caregiver consultant and coach, and a certified life coach. So basically, whatever problem you have, you can just call Brenda. And it seems like she's going to be able to resolve it. And she works with groups and one-on-one, and she has a podcast that she facilitates on caregiving.com. Thanks so much for being here, Brenda. I want to start off first and just kind of setting the stage of your caregiving experience. So tell me about Nikki, your daughter. How old is she and what are her needs?
My daughter, Nikki, is 28 and a half years old now, and she wasn't breathing when she was born. My pregnancy was completely normal. We ran into trouble with labor and delivery, and she was not breathing when she was born. So she was whisked off. I didn't get to see her until the next day. She had to be resuscitated. She had a lot of swelling on her brain, which caused a lot of seizures. She was kept comatose for the first several days of her life to settle her brain down and settle the seizures down. It was definitely not what I envisioned having a baby would be like. And initially, it was confusing because initially the residents and the nurses were telling us that her prognosis looked fairly grim. One resident even told me that she had no brain activity on EEG. So there was a lot of fear, a lot of unknowns. And then the consultant, we finally got to see the neurologist consultant at, I think, 3 days. And he said to me, I think she's going to be fine. Like, don't worry.
That's pretty, that's a range. Like, she's not going to make it and she's going to be fine. It's like, okay, so how do I process these emotions when, like, am I leaving with my child or am I not? And if
Exactly.
I do, are there going to be, you know, concerns?
I mean, it was easy to believe the grim prognosis because here's this baby in this isolette that I can't barely touch, who has lines coming out of every orifice of her body, an IV in her head, tube down her throat, and her head was swollen from brain swelling. So it was pretty scary. And I grew up actually as a sibling to a brother who was born prematurely and as a result has cerebral palsy. He was mostly affected physically, but I even touched on that with this neurologist. I said, he gave me the stats that he was right 85% of the time and wrong 15% of the time. So I said to him, well, if you're wrong, what could we be facing? I have a brother with CP. Could we be facing something like that? So I wasn't completely, I had some exposure to disability growing up. So he said, no, I don't want you to go there. I don't want you to go there at all. I'm pretty confident that she's going to be fine, but we'll do a CT scan when she's 2 weeks old, once the brain swelling has settled down, and we'll have a better idea. So the day of that 2-week appointment after her CT scan, the moment he walked into the room, I knew that the news was not good. And the news was that she suffered global brain damage, meaning that she would never be able to walk, talk, or feed herself.
And has that proven to be true? Because I know last week
Yes.
you saw me interview Mike George, and his son, although he was told the same thing, has managed to do more than what they thought were capable. But for your daughter, that's the case. She can't walk, talk, or feed herself or anything, no?
No, she can't. Now, like Ben, Nikki does also use an augmentative communication device, but
Right.
she's not as, and she uses her eyes to activate it, but she's not as advanced as Ben is. We've just started using a keyboard on it with her, but I'm not even sure she knows how to spell. So those are the kind of things that we didn't focus on in school. We focused on things that were what she's using now, augmentative communication. And back then, she was able to press a button that would be able to set off a machine that would talk for her, but that would all be pre-programmed. Now, this device is also pre-programmed, but she's got a world of opportunities with it. She is able to tell us that she needs her headrest adjusted, or she wants a boost in her chair, or she needs a suction. She can choose to have her hair up in a bun or curly or braids or barrettes, or she can choose which color she wants her nails to be painted. So it really has opened up her world in that aspect, but it's more to do with personal preferences, not really academic.
But even that, Brenda, I'm touched to hear that, because it gives you a chance to make a connection with her in a way that you wouldn't have expected. You probably are still learning about your 28-year-old child, things, even just preferences that you didn't even know existed. And it must feel so nice for her to know that she's being understood, because I cannot imagine what it's like from I'll just use the term patient perspective, of wanting to communicate and be understood and feeling like you're non-existent in a world of people who are existing. So these alternative communication things are just amazing to me.
Her capabilities have definitely been underestimated. And even though some people might say, well, maybe she's just glancing over that box on the screen, maybe she's looking at it by accident, we've tested her capabilities. And with things like, we've got pictures of myself, the dog, her care workers, and I will test her and I'll say, who's in the room right now? And I would say 90% of the time she gets it right. She does have a deviated eye, and it is a difficult device to use. I have tried it, and after several minutes, my eyes get tired. So it's not as easy as people think it is. It does take concerted effort. And the therapists who work with these type of devices, they set it so that there has to be a concentrated visual. Your eyes have to concentrate on that spot for a specific amount of time for it to be activated. And we've tested that with different amounts of time. So, and it's really awesome as well, because they're able to update it electronically. So they don't have to come to the house anymore. And with COVID, that's been a godsend because she's lost a lot of supports during COVID.
Yeah.
So to be able to keep up with the communication aspect and continue growing with that during COVID has definitely been great for her.
So I want to talk about that because you're mentioning quite a lot of things that to me are financially, there's a financial implication, which is one of the things I want to talk about today. But before I get to that, I just want to say that Darcy said, incredible story from an incredible mom. You and Nikki are both amazing people. So you have a lot of support watching today, which is really nice.
Thank
Um,
you all.
so you've mentioned a few things because you were talking about care workers. We've talked about these devices. Um, and we're talking about equipment. If she can't walk or talk, walk. I mean, I can imagine the kind of equipment. You talked about a headrest. So you've already just in our discussion mentioned things just kind of on an aside, but I'm hearing money, 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 and all the time. How, like when you got home from the hospital and then the progression, did you even have any clue as to how much this would cost your
None,
family?
none at all.
And how were you prepared for that? Like, how do you do that?
Well, and that is one reason I got into the business I'm in now, because I wish that when I was going through those stages with my daughter that I had somebody who could have guided me. I often refer to it as a maze. And if I had someone like myself who could help me avoid some of those dead ends, then it would save me a lot of time, aggravation, and money. Now, there are some government programs that do pay for some of these devices. A lot of it is means tested. So, for example, there is ODSP for children who are over 18.
What's ODSP?
ODSP, for those in Ontario, is Ontario Disability Support Payment. So it's the
Okay.
disability
Okay.
pension, the
Okay.
provincial disability pension. So if you qualify for the disability pension, you can have subsidies for equipment. If a family has benefits through an employer, that is amazing as well. There are so many things. Like I did mention the wheelchair. Through ODSP, and even before the age of 18, there is assistance for children with severe disabilities, ACSD, through the same ministry of the government. But that is means tested, and the family income, I believe it has to be 60,000 or less, which is really not a lot to live on. And if you are less than that, you don't qualify. If you do qualify for it, you can have some drugs covered. You can have the 25% of equipment covered. The government will cover equipment up to 75% through assisted devices program, but without the extra supports through the government or without benefits, you're covering at least 25% of those. And I will add even more. So for example, a wheelchair will only be covered every 5 years.
Yeah, but a person's growing and changing, and right? So
Yeah.
you might need, especially like you think of the age from like two to six or something like the size difference is astronomical of a kid growing from 2 to 6.
Yes. So there are some guidelines around that as well. And if there's enough proof that the growth has surpassed the size of the wheelchair, then there are appeals that you can go through. But that's all time and energy that the parent, the therapist, everybody has to put
And
into that.
let me pause you on that, Brenda, because I know you can list all sorts of different types of programs for different expenses. And but I want people, they can contact you directly. This is the work you do and you can help. But let me just get to how you manage that. Because when your daughter is discharged home from the hospital, and you and I have had an exchange about the importance of team caregiving, right? You can't be in isolation even as a parent of a newborn. When your child doesn't have problems, you have no idea what the hell you're doing. At least I didn't, and I was nervous all the time, didn't know what to do, and I had no, support. Is there a team that's automatically put into place and then, is connected with you so that they're in the community and then can help you learn about all of these resources? Or is it just kind of like, well, here you go, here's your daughter, and let's just see what happens?
Not necessarily. I was fortunate that I live in a center in London, Ontario, where there is a rehabilitation center for children with physical disabilities, developmental delays. There's actually two facilities here. One is Thames Valley Children's Center, which is a rehab center, and the other one is CPRI. It's changed names several times, and Child Parent Resource Institute. They do have a lot more involvement with those who are more developmentally challenged and behaviorally challenged. But there was a program through them called Home Visiting Program for Infants that I was fortunate to have involved with our care. And to
Did
be
you know
honest,
to ask, Brenda? Did you know to ask for that, or the hospital is the one that told you?
I believe that it was 28 plus years ago. I can't even remember. I believe it was an automatic referral.
Okay.
But I do remember, on that note, I do remember a nurse chasing after me. The day we got the news about my daughter, I was already back in the hospital myself, staying with her overnight and learning how to care for her, breastfeeding, all of that kind of stuff, getting accustomed to that. The day we got the news, we discharged her against medical advice. But I felt so betrayed and so let down that I didn't want anything to do with them again. And easy for me to think that then it's been a lifetime of the hospital. But a nurse, I remember running after us when we were at the elevator, leaving and with a piece of paper, and she said, "You have to call this number. They will help you with your daughter." And it was a program called Special Services at Home. And I was like, nope, I am taking my daughter home and I'm going to take care of her. But little did I know that that program had a 1.5 year waiting list.
Oh, wow.
And if I had someone like me, I would have said to that person, just humor me, put your name on the list, because you don't know when you're going to need that. And sadly, my family lives all out on the West Coast, Alberta and BC. So I had no family involvement, no family help that could just jump in, like no mom who could come in and say, "I'm going to come in and save the world for you." Nothing like that. So we were completely on our own to navigate this and figure it out. And once I got to the point where I just could not do it anymore, she was about 1.5 years. And I finally called, and they still had a 1.5 year waiting list. So if I had someone like myself in my corner back then, and I would love to get in with those families, but of course there's a lot of barriers for confidentiality and what have you. But to get in with those families early on to help them and be that guide for them, that's one of my passions.
Yeah, and that's how you're helping people in your work, which is amazing when you take your own personal experience and flip that in order to, pay it forward and make a career out of helping people in your situation. So financially, obviously, you've had to put out and continue to spend lots of money because even though there are programs, there's a percentage of a copay, and there's probably things that you've had to do that there's no coverage at all and are strictly out of pocket. So when you're thinking about this long term and thinking that, one day you might not be here, how do you imagine like planning for your daughter's financial security and care once you've gone? And we'll get to what happens if you just get ill or need a surgery. That's another issue, but I'm just talking about once you're gone after your death. How do you plan for that and think about that? And second to that, you also have to think about your own retirement and your own financial needs too, right? So you've got both things that you're needing to like save for and prepare for. What's that thought process like?
Well, I'm glad you opened with that you're a worrier. That's frowned upon by a lot of, and even in coaching, it's frowned upon. Don't put yourself in the future because that hasn't happened yet.
And I agree
But
with that in a lot of ways, but let me just say on the side before you get into it, being a warrior also helps you prepare for a lot of things that you
exactly.
need. So there are some advantages. That's what I told my husband when COVID hit, and I was like, yeah, you make fun of me being a warrior. Guess what I have in our closet? A bunch of masks, a bunch of, yeah, I'm a warrior, but guess what? Now I'm prepared. So there's a little bit of some advantage to that. I'm sorry, Brenda, but go
I
ahead. And
totally
let me tell
agree.
you that Nicola Irvine from New Zealand says hello, and you're a guiding light, and you're
Ah,
awesome,
Nicola, thank you so much.
Nicola.
Her name is Nikki as well. So
Oh, okay,
I'm working with Nicola. So she's amazing. Thank you,
okay.
Nicola.
So tell me about that, the planning for the future.
Well,
What's your
and
thought process?
exactly the worrying, of course, I can't just expect that things are going to fall in place. And I know that if something happened to me, my daughter would be immediately put in a nursing home. Her needs would not be met in a nursing home. That would be her demise. And of course, we know everything, so much has been exposed about long-term care in nursing homes. So that is a huge fear. And as a sole parent with no family nearby, it adds to that stress and that anxiety. And exactly, the worrying, for example, I have no coverage for care over Christmas weekend. So if I didn't worry about that now and try and do what I could to try and fill those shifts, then I would be left completely without help for 3 days. And my daughter does require care, awake care overnight. So that's not sustainable for one person to do. 3 days, 3 nights, no sleep. So it definitely is a worry. And for as far as preparing for her future, I took my own advice. And as much as I didn't want to do this, I put her name on the list for assisted living when she turned 18. I have said that I would never, ever put her into an assisted living home, but I also didn't know I was going to be a sole parent and trying to manage this by myself. Also, at the time, I was told that the waiting list is 10 years.
What?
Yes.
10 years?
And I was told at the time that you never know what's going to happen. So if that time comes and you're not prepared, then you can turn it down. So I took that advice, and she's been on a list for 10 years.
Wow. First of all, oh my God, 10 years. And I guess that's the one, there's benefits of having a socialized system of medicine in which you can get care at a very reasonable price so that your loved one can have care around the clock in a safe environment. But the negative piece of that is we wait and wait and wait and wait. And there's a lot of people in the world of aging, which is, as you know, Brenda, my specialty, where I give the same advice when they say, I don't want my mom to move into a nursing home. And I say, that's okay. Then you can refuse it when the bed is available. But just let's get this moving because you don't know where you're going to be emotionally, physically, financially at the time when that bed is available, and you might just be thanking your lucky stars that you thought ahead. So that's in terms of like the care, but what about like a decision maker? So I don't want to be like really grim, but I'm hoping, I know, Brenda, that you're open to discussing this because I think it's helpful for people. We have to think about, if we're no longer here, who's the guardian, who's the decision maker? And even as a parent of kids without special needs, my husband and I have had to have that talk. If we both die, who's going to care for our kids? They're still minors. How do you go through that thought process? Because it's not a limited period of time like it would be for me and my husband and our kids. It's a forever time. And I know that Nikki's an only child, so you also can't look at siblings as a potential. So what's your thought process? Like, how do you do that?
It's a very difficult one because there's the only people who are in our lives helping me care for her are paid caregivers. And are they willing to take that responsibility? So, I've asked somebody who is not really in our lives right now, but I know would have my daughter's best interests in mind to step into that role. Having her on the waiting list for assisted living, I hope would give her a leg up if there was a crisis. But there's also other things to consider. There's power of attorney. If your child does have the capability of assigning or directing their own care and assigning a power of attorney, then that's really helpful. Legal guardianship is there to go if they don't, but that is extremely time intensive and extremely costly. And then you're pretty much leaving it up to the government in that situation for at least a short period of time, because you assign everything to the public trustee, and then you apply to the public trustee to become the legal guardianship. And you have to have a backup for that as well. In a case where assisted living is they would take over that role. There's also a lot of documentation and behind the scenes work to take care of all of that as well. And I have not experienced that yet myself. So it's difficult for me to go into those specific details, but there are some other options if it's financially feasible for the family. And that's the catch. There are families I know of who've built their own homes for their children and have hired their own staff. That is really costly venture, or they've gone into an arrangement with an existing provider and pay that provider to staff the home. There's also something for adult children who do have a little bit more say in directing their own care, called Microboards Ontario. And that is a family basically creating a not-for-profit for their child. And there is a board of directors on the not-for-profit, and they're not the paid people helping to care for the individual. They are volunteers, and they manage that person's life and ensure that their needs are being met in every way, shape, and form. Someone might have strong organizational skills or accounting skills. Someone might have strong social media skills if the person wants to be present on social media. Each of them has a strength. So that's a growing trend here in Ontario, and I believe BC as well. So there are some other options that people can look into, but it definitely worries me. And I've actually got an airway condition myself. It's called idiopathic subglottic stenosis. I've had it for the last 14 years. It took me 2.5 years to be diagnosed. So 12 years I've been treated for it, and I've had to have repeated dilatations of my trachea. If I cough or I sound like I'm gasping for breath or I sound a little bit gravelly, it's because of all the surgeries I've had on my trachea. So every single time I go in for surgery, I'm scared.
Absolutely.
Because what if the care worker at my home cancels that night and I'm post-op, post-anesthetic, and then I'm forced to take care of my daughter? Fortunately, that hasn't happened, but my last surgery in August, I did have a situation where an agency promised me they'd cover one of their staff's holidays that was also occurring during the time I was having my surgery and post-op recovery, and they weren't able to cover it. So I had to scramble. And luckily, I have an amazing team of private staff as well who really have my back and really have my daughter's back. And on that comment as well, there's other programs. There's a program in Ontario called Passport Funding. It has nothing to do with the travel passport. It's just the name of the funding, and it's through the Ministry of Community and Social Services. Before the age of 18, here it's called Special Services at Home. And it's a pocket of funding that families are given to self-administer their own care. So we hire our own care providers and pay for them out of that funding.
So there's some things that you're talking about that sound similar to things that go on in Quebec. And but instead of getting into some of those more specific programs, I just want to talk about in general how important it is to have someone like you in families' lives early on to think ahead, to start planning, thinking of those legal documents, having conversations with other family and friends, making backup arrangements, because you want to be able to focus on the care and support and love of your child, and not always in the back of your mind have the worries all the time. So once you can come up with that, solidified plan and feel comfortable, at least that's kind of one more thing that you can sort of just push aside and say, okay, I know that things are in place. Brenda, I want to move on as we're winding down on time to talk a bit about.
Can I just add one more
Of
thing to
course.
that? It's not just in early life. I want to also add it's the transition from pediatric to adult healthcare
Yes.
and
Oh,
programming.
yes.
There's a huge drop off. It's almost like our children turn 18 and they all of a sudden don't exist, or all of a sudden the government thinks that their disabilities are gone. And just because they've turned 18, they lose some of the programming, they lose some of the funding that they've had all their lives. And then parents need to navigate that it's a whole new world. There's nothing seamless about it. I like to say that I like to use the analogy that we're dropped off in the middle of an ocean in a canoe with no oars, and it's up to us to figure out how to get from shore to shore. And I say shore to shore because we could get to one shore and be turned away, particularly in the adult healthcare system. And adult doctors can refuse to take a patient on.
Hmm.
You have no choice but to seek care in a particular specialty, but they might not want to, as I was told by an adult specialist himself, they might not want to quarterback these children. And what I like to prepare parents for too is when your child turns 13, 14, start preparing for that transition. For example, my daughter was referred to a nephrologist when she was 16, and it took a year to see this man. I advocated to see an adult nephrologist, but the pediatrician didn't know any. So what happened is we saw that one specialist when she turned 17, and he wanted to see her again in a year. Oh, but she's turning 18, so we'll refer you to an adult nephrologist now.
So there's no
It would
continuity of care
no,
either.
yeah.
Yeah.
So I help advocate for in team meetings, a lot of team meetings during that transition to transfer knowledge. And I want to add too that at any time in a child's life, the parent or caregiver is the most important member of the team outside of the child themselves, but particularly in a situation like mine, where my daughter doesn't have a voice and I am her voice. I have what I like to say is a PhD in Nickyology, and no one has studied her as long as I have.
Absolutely. Absolutely, Brenda. You bring up two really good points. Thank you for bringing up the transition from pediatric to adult world. And I'd like to say even adult world to older adult world,
Yeah.
because those are some additional things that we have to think about. We don't have time to get into that, but
No.
that is a whole other aspect, is caring for this particular population as they're older adults in their 70s, 80s, 90s. What does that look like? And now you're just talking about that team caregiving concept, and also in addition the importance of the primary caregiver, which, I mean, my book is about aging, but I talk about that all the time. And one of my frustrations, and I'm sure yours too, Brenda, is that the care is focused on the patient, which I understand, but if the caregiver is not seen as an integral part of that team and as important as the patient, the whole plan is going to fall to the wayside anyways. You have to be treating and intervening at both levels, the caregiver level and the patient level, in order for any plan to be successful.
Absolutely, 100%.
Yeah. So let me just finish with this final piece. I just want to talk about your own. Oh, by the way, Dr. Erica Harris says, always love your insights, Brenda. And Nicholas said you are the expert in Nikki. It's true.
Oh,
And I just
thank you,
like that, the
both of you.
Nickyology. It's fun. My son lives with anxiety, and I've had to be his advocate in the school system. And so many specialists will say to me, oh, you can try this, try this, try that. And I'm open. I can listen. I mean, absolutely. I'm absolutely open, but there are so many things that I already know are not going to work. And I get frustrated when the professionals are telling me, oh no, but you have to. I'm like, no, but you don't understand. And then eventually it's like, okay, fine, try it. Then it doesn't work. And I'm like, I told you, I know my son, so I totally appreciate that. Anyway,
I had an
sorry.
intensive, just quickly, I had an intensive care specialist in the pediatric ICU when Nikki was 15. She almost died. It was very scary. And I, at one point, told them to throw out their medical books, that Nikki wrote her own. And near the end of her stay, I walked into the unit and I saw him leaning up against the doorway with his arms crossed, just looking at her in awe. And I walked up to him and I said, "Is everything okay?" And he just shook his head and he said, "You were right, Brenda. She writes her own book."
Mm.
So getting that validation
Yeah.
is very important as well.
And I like to hear that there was a professional who changed his tune and opened his mind that, okay, maybe that changed his experience as a professional. And maybe he will now listen more to parents when they say, no, please let me share what the experience has been for us, instead of always coming in like, no, I'm the expert. I know absolutely what's going to work. So that's really nice, actually, that happened on both levels for your family and also hopefully for him and his profession. So my last question to you is just your own personal financial retirement. Is that something else that you worry about, because you're having to set aside all these funds for Nikki? And I say having to, and I don't mean that in any disrespectful way. I'm sure it is your pleasure to arrange for care for her. I don't mean to imply that it's not, but obviously money is going there. So what does that mean for you? Is this something that you lie in bed awake at night worried about as well?
I absolutely do, 100%. 100%. If it's not actual money that is going out for her care. And I might add that with COVID, she lost her day program, her full-time day program, and her overnight respite. So she's out more than 5,000 hours of support since COVID started, of out-of-home support that we didn't have to pay for.
Oh,
So if it's
wow.
not money, it's time and energy. And that is really difficult to put a dollar figure on. Very difficult. I mean, I'm caring for a 28-and-a-half-year-old child whose care is 100 times more intense than an infant baby's. I can do everything a nurse can do. And we're very invasive with her medical requirements. She requires a lot of medical interventions. So if it's not money, it's my time and energy. And as I get older, that definitely becomes a worry. It's not just about my financial future. It's about my physical and mental future as well.
Yeah. Yeah. David just wrote, and I'm not sure if this was for you or me, it says, great information. Might we set up a time to chat, as I offer services that are very important and are complimentary? And he has his email. So that should be in the comments after the feed, but I'll copy and paste it and send it to you as well. Brendan, you can
Okay.
follow up. If that was meant for me, then let me know, but I have a feeling it was meant for you.
Okay.
Brenda, this has been really enlightening for me, and I appreciate your honesty and transparency about the difficulties. And I know it's not easy to think about a time when we're not well ourselves, or that we pass on, and what does this mean for our family? And I appreciate you being open to me asking those direct questions, because I think people want to know, but they're afraid to ask. And so thank you so much for doing this chat with me. I really appreciate it. So Brenda, you offer first of all, you have a podcast on caregiving.com. People can find that. And also you offer one-on-one coaching services, group coaching, and you can do keynote speaking and those kinds of things. Where can people find you? And I will also post your website in the comments, but where can people find you?
Sure. They can find me at my website, www.coachingforcaregiverscanada.com. They can also find me at Coaching for Caregivers Canada on Facebook and Instagram. They can find me with my name on LinkedIn, Brenda Blaze Nesbitt. And they can also find my podcast on caregiving.com's website, Caring Conversations. I'm hosting their first season of their relaunch, and my season is all about caring for and raising children with disabilities and complex needs from infancy to adulthood.
Amazing. Amazing. Thank you so much, Brenda. Thank you for everybody for engaging and all the comments. I really appreciate that. So does Brenda. I know
I
because she
do.
already
Thank
said
you
it.
so much.
I don't think I'm speaking out of turn. You did say thank
No.
you. Hang on, Brenda. I'm going to end the broadcast, but I want you to hang on. And thanks, everybody. And the link will be up on my YouTube channel. Should anybody wish to share it with any of their colleagues or friends or family, feel free to go to my YouTube channel and you can send that link. So thanks, everybody. And hang on, Brenda.
I will.